welcome to the Lean In, Lift Up podcast. I'm Nicole Martin, a Master of Social Work student at Cal Poly Humboldt. I live in and work on the unceded land of the Cholula, Hupa, Karuk, Matol, Tolowa, Senangwe, Wiyot, and Yurok people currently known as Humboldt County, California. I strive to approach this podcast with humility and respect while navigating all topics. I'm so glad you're joining us as we explore the important world of child welfare. We'll chat today about the unique challenges social workers, families, and children face in rural communities. Today, we'll uncover a vital yet often overlooked hurdle in accessing child welfare services: geography. I've worked in the social work field for about 4 years now, and I've seen how something as simple as a road closure can make the difference between a family getting the support they need or falling through the cracks. This work is not easy, but it is crucial. Let's get into it. Access to child welfare services may seem relatively straightforward for those working in urban environments. There are public transportation options, a range of providers, and services clustered within a reasonable distance. However, these resources are often spread out across vast areas for rural social workers and families, requiring hours of travel, logistical coordination, and creative problem solving. Humboldt, for example, is 4,052 square miles of dense redwood forests, mountains, and coastline. In today's episode, we'll explore how distance, isolation, and transportation barriers impact child welfare services in rural areas. We'll walk through a typical day for a rural investigative social worker, highlight specific challenges in places like Siskiyou and Kern Counties, and examine how decentralized services like family resource centers and telehealth are used to bridge the gap. Let's roll up our sleeves and get into it. Let's look at a typical day in the community for an investigative social worker. Investigative social workers make home visits to investigate reports of abuse or neglect, assess children's living situations, and provide services such as counseling, housing assistance, and parent education and support. They also help families apply for social benefits or child care assistance. It's 8 a.m. You walk into the office. The kind of quiet that only exists before the phone starts ringing and the meetings begin. You pour a cup of lukewarm coffee, open your email, and there it is, a message from your supervisor. Can you come talk to me when you get in? You head to her office, heart already a little tight. She gives you a tired smile. 3 new investigations came in this morning, she says. One of them needs to be seen right away. It's at the hospital. I know you were supposed to be out at the school today, the one 2 hours away, but... You nod. Got it. I'll head to the hospital first and adjust from there. You go back to your desk and start piecing it together. You skim the intake report. It's about a newborn. The parents don't have stable housing or even a car seat to leave the hospital. You check the road conditions. There are multiple construction stops on the highway, and a storm's rolling in later this afternoon. You take a breath, pack your bag, and hit the road. At the hospital, the lights are too bright and the air smells like bleach and hand sanitizer. The baby is sleeping soundly, tucked into a pink and blue striped blanket. The parents are quiet, weary, sitting on edge in 2 plastic chairs. We don't have anywhere to go, the mother tells you. Our car got towed. We were staying in it. You sit with them, talking through the possibilities. It's not a long conversation, but it is an intense one. You help them arrange to borrow a car seat from a family friend, and that same friend agrees to drive them to the aunt's house for now. You get the necessary releases signed, talk safety, and plan to refer them for housing services as soon as you get back to your desk. It's 10:30 by the time you're walking out, heart heavy but steady. Then it's off to the school. 2 hours up into the mountains. The drive is slow. The storm clouds have arrived, hanging low and heavy. The construction stops make the trip crawl. You finally pull into the school parking lot just before 1 p.m. You check your phone, missed call from your supervisor. When you call her back, there's another request. A coworker trying to locate a family who might be near the school. They're affiliated with the local tribe, so you'll need to coordinate with the tribal social worker. You add it to the mental list. First, talk to the kids. You're able to meet with 4 of the 5, 2 sets of siblings. One of the younger ones draws while you talk, pressing hard on the crayon like they're trying to work something out with each line. The fifth child wasn't at school today. You head to the tribal office and meet with the tribal social worker who's been working in the area for decades. They nod when you say the family name. Oh, I know who you're talking about. Haven't seen them in a while. They might be staying with the grandma. You drive out to the grandmother's home. Fenced-in yard, a barking dog, a car that looks like it hasn't moved in months. You call out a few times, wait in the rain. Nothing. You swing by the sheriff's station next. The deputy you talk to knows the family too, but has the same address as the grandmother's. No recent calls, he adds. You and the tribal social worker decide to try one last spot, a tribal head start nearly an hour away. You arrive just before closing. The child was enrolled, the staff tells you, but they haven't been around in a while. You thank them, head back to the tribal office, and check your phone. It's almost 5 p.m. You call your supervisor before heading out, just in case. I'm leaving now, but I'll be out of service soon. About half an hour into the drive, traffic stops completely. A Caltrans worker comes up to your window, soaked and tired. There's been a rock slide ahead, he tells you. Could be a couple hours, maybe more. You'll probably need to turn back. You drive back to the last town you pass through and find a spot with cell service. It's after hours now, so you call the on-call supervisor. Turns out another social worker is also stuck nearby. You meet up at a small diner, the kind with squeaky booths and pie under glass. You both order something hot just to feel grounded. You were supposed to have dinner with friends visiting from out of town tonight. You call them to cancel. You haven't seen them in over a year, and you can hear the disappointment in their voices when they say, "Maybe next time." "Yeah," you say softly. "I hope so." Your supervisor arranges for you to stay at the local motel. You're checking in, just wanting a hot shower and a quiet room, when your phone rings. It's the sheriff's office. "We got a tip. The family you've been looking for? We think they're at that motel." You almost laugh. Of course they are. You sleep. Restless, but it's something. The next morning at 8, you sit on the edge of your motel bed, writing up notes, entering contacts into the system. Around 9:15, you walk to the room the deputy mentioned and knock. The door opens a few inches. You introduce yourself gently and ask if you can talk. You meet with the family, check on the child. They're overwhelmed, unsure of what comes next. You listen, and then you offer help. "There's a resource center a few blocks from here," you say. "Would you like me to walk with you?" They agree. Together, you walk to the center. The family gets bus passes, a lifeline phone, fresh clothes, food, and help signing up for CalFresh. They set an appointment for housing and job support later in the week. When you part ways, there's still uncertainty, but now there's also direction. You call your supervisor with the update. The roads are finally cleared, and you make the drive back to the office. The rest of the day is supervision, case notes, paperwork. It's a long 36 hours, and it's not unusual. This is what rural child welfare looks like. It's unpredictable, it's messy, and it's deeply human. From navigating storms and remote mountain roads to collaborating with tribal partners and linking families to life-changing resources, the work requires flexibility, cultural sensitivity, and an unwavering commitment to child safety and family well-being. While no 2 days are the same, each movement is an opportunity to advocate, support, and connect, making a meaningful impact in the lives of children and families who need it most. Now, consider the families who need services. A mother with an open child welfare case lives on the coast so she can access services. Her baby is living with a family member who lives 2 hours away, and they are supposed to have a minimum of 4 hours of supervised visitation a week. Mom does not have a car, and there's no public transportation between the two towns, and the place where her baby lives is the source of her trauma. The family member is not supportive of reunification services and refuses to drive out to the coast twice a week, stating that the wear on her vehicle would be too much. A team of 3 social workers will coordinate the transportation of the child and supervise the visit. 10 hours of the day are dedicated to ensuring this family gets the services they need and are entitled to. It's not sustainable, but it's the best solution at the time. Even if they could get a ride, the cost of gas and lost wages from missing work makes it nearly impossible. This is common in rural areas where services are centralized in urban hubs, leaving rural residents with few options. Studies show that limited transportation significantly reduces referral follow-through. Children needing specialized medical or psychological care may go without simply because the logistics are insurmountable. For social workers, this means getting creative, coordinating rides, advocating for mobile services, and pushing for policy changes that acknowledge these challenges. Let's take a look at 2 counties where geography plays a significant role in child welfare access. Siskiyou County is one of the most remote regions in California, spanning 6,347 square miles of rugged, mountainous terrain. Its small, widely dispersed communities pose unique challenges for service delivery. Social workers often travel 3 to 4 hours round trip for a single home visit. In winter, snowstorms can isolate entire towns for days, delaying critical services and placing vulnerable children at increased risk. The county operates 7 community resource centers in Wairika, Fort Jones, Montague, Weed, Mount Shasta, McLeod, and Dunsmuir, covering a stretch of 46 miles. However, residents in far western communities, such as Happy Camp, must travel 70 miles to Wairika to access services. The county's child welfare office is also based in Wairika. Public transportation is limited. The Siskiyou Transit and General Express stage runs only on weekdays, and although it typically operates 6 routes, service between Happy Camp and Wairika is suspended at time of recording. Kern County, though geographically distinct, faces its own set of unique challenges. Spanning 8,163 square miles of farmland and desert, its rural communities are often isolated and lack the infrastructure commonly found in more urban areas. Public transportation is limited, making it difficult for residents to access essential services. As a result, social service deliveries rely heavily on caseworkers traveling to clients in person. The county operates 19 family resource centers spread across 14 cities, covering 157 miles. 6 of which are located in Bakersfield, as is the Child Welfare Office. These examples highlight a key issue. Rural social workers spend a significant portion of their time simply getting from place to place, reducing the time they can spend on direct services. One way rural communities are addressing these barriers is through decentralized service models. Family resource centers, FRCs, and community hubs allow multiple services, mental health counseling, parenting classes, medical care, to be provided closer to where families live. These centers began popping up in the 90s in recognition of the idea that community-based support is key to early intervention. For example, in Humboldt County, FRCs have become vital to bridging the gap. The Humboldt County Network of Family Resource Centers was created in 1991, and the first Family Resource Center opened between 1997 and 2002. They serve as one-stop shops, reducing families' travel burdens. However, even these centers struggle with funding, staffing shortages, and the same geographic challenges that impact other services. Most of these centers are grant-funded, and more funds must be given to these vital community hubs. The rise of telehealth and virtual case management has offered some relief. Remote therapy sessions and virtual check-ins help reduce travel time for social workers and families. It also gives families control over their appointments. They get to choose their camera angles, or if they even want the camera on at all, and they get to show only what they want on camera. However, access to reliable internet and technology is another hurdle. Many rural areas lack broadband infrastructure, and many rural families do not have computers or laptops in their homes, nor do they always have the knowledge to operate them, limiting the effectiveness of these solutions. Despite these challenges, telehealth remains a promising tool, especially for mental health services where in-person visits aren't always necessary. Expanding broadband access and technology education could be a game changer for child welfare services in rural areas. So, what can be done? Addressing these geographic barriers requires a multifaceted approach that considers both immediate needs and long-term solutions. Invest in rural infrastructure such as roads, public transportation, and broadband to improve access and connectivity. Expand education and technology access in isolated communities to support digital inclusion and adapt to growing infrastructure demands. Deploy mobile service units that deliver healthcare and social services directly to families in remote areas. Increase funding for family resource centers and other community-based services to help decentralize care and better serve outlying areas. Encourage policymakers to integrate geographic considerations in their designs and funding of social service programs. And include tribal nations in planning and decision-making, recognizing that many of these infrastructure and service expansions occur on or near native land. Tribal communities have unique needs, histories, and solutions that must be centered in a meaningful approach. Building trust, honoring sovereignty, and fostering true collaboration are essential to ensuring equitable and sustainable outcomes. The reality of rural child welfare work is one of perseverance, innovation, and relentless advocacy. Geography should not determine the quality of care a child or family receives, yet for many, it remains a defining factor in their ability to access support. To all the social workers, advocates, and policymakers listening, this work is critical. Raising awareness and pushing for systemic changes can create a future where services are accessible no matter where a child lives. Thanks for tuning in to Lean and Lift Up. If you found today's discussion valuable, please subscribe, share, and stay connected. Join us next time as we discuss building connections in small communities and the reality of dual relationships. Until then, take care and keep lifting up those who need it most.